Hi everyone, today I'll be talking about the sepsis definition and different scoring systems for sepsis. The sepsis 3 definition, which came out as part of the 2016 International Guidelines for Sepsis and Septic Shock, defines sepsis as a life-threatening organ dysfunction caused by dysregulated host response to infection. Organ dysfunction can be defined as an acute change in SOFA score of greater than 2 points. Baseline SOFA score is 0 in patients not known to have any pre-existing organ dysfunction. Septic shock is defined as persistent hypotension requiring vasopressors to keep mean arterial pressure greater than 65 mmHg after initial fluid resuscitation and having serum lactate greater than 2 millimoles per liter. Sepsis 2 definition, which was part of the 2001 International Guidelines for Sepsis and Septic Shock, defines sepsis as a known or suspected infection with 2 or more of the SIRS criteria. SIRS stands for Systemic Inflammatory Response Syndrome. You need to meet 2 out of the 4 SIRS criteria for diagnosis of sepsis, which are temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, WBC greater than 12,000 or less than 4,000 or greater than 10% of bands, respiratory rate greater than 20 breaths per minute. Now coming to the SOFA score, which is a sequential organ failure assessment. The SOFA score ranges from a minimum of 0 to a maximum of 24. It has 6 variables in it, which are respiratory, coagulation, liver, cardiovascular, central nervous system, and renal. Each variable has SOFA score from 0 to 4. Coming to the first variable, which is respiratory, we measure PaO2/FiO2 ratio in mmHg. If it is greater than 400, then the score is 0. If it's less than 400, score is 1. If it's less than 300, score is 2. And if it's less than 200, score is 3. And if it's less than 100, score is 4. Next variable is coagulation, where we measure the platelets. If the platelet count is greater than 150,000, the score is 0. If the count is less than 150,000, it's 1. If it's less than 100,000, the score is 2. If it's less than 50,000, the score is 3. And if it's less than 20,000, the score is 4. Next variable is liver, where we measure the bilirubin in milligrams per deciliter. If the bilirubin is less than 1.2, the score is 0. If it is between 1.2 and 1.9, the score is 1. If it's between 2 and 5.9, the score is 2. If it's between 6 and 11.9, the score is 3. And if it's greater than 12, the score is 4. Next variable is cardiovascular. If there is no evidence of hypertension, the SOFA score is 0. If the mean arterial pressure is less than 70 mmHg, the SOFA score is 1. If there is requirement for vasopressor in the form of dopamine at less than 5 micrograms, the SOFA score is 2. If the dopamine requirement is greater than 5 micrograms and if there's requirement for epinephrine or norepinephrine at less than 0.1 micrograms, the score is 3. If the dopamine requirement is greater than 15 micrograms and the requirement for epinephrine or norepinephrine is greater than 0.1 micrograms, the score is 4. Next variable is central nervous system, where we measure the Glasgow Coma score. If the GCS score is 15, then the SOFA score is 0. If it's between 13 to 14, the score is 1. If it's between 10 to 12, the score is 2. If it's between 6 to 9, the score is 3. And if it's less than 6, the score is 4. Next variable is renal, where we measure creatinine in milligrams per deciliter. If the creatinine is less than 1.2, the score is 0. If it's between 1.2 and 1.9, the score is 1. If it's between 2 to 3.4, the score is 2. If it's between 3.5 to 4.9, the score is 3. And if it's greater than 5, the score is 4. Let's talk about the Q-SOFA score, which was introduced at the 3rd International Consensus Definition for Sepsis and Septic Shock to detect patients outside the intensive care unit who are at risk for developing sepsis. It has 3 variables. One has to meet 2 out of the 3 criteria, which are respirations greater than 22 per minute, altered mental status with Glasgow Coma score of less than 15, and systolic blood pressure less than 100 mmHg. A score of 2 or more is associated with increased mortality. Let's talk about the prognostic accuracy of the SOFA score, service criteria, and Q SOFA score for in-hospital mortality among adults with sepsis admitted to the intensive care unit. This was published in the JAMA article in January of 2017. In the first graph here, we're looking at the SOFA score in relation to the mortality. One can see as the SOFA score increases from 0 to 24, there is an increase in mortality. When the SOFA score is 2, the mortality is less than 10%. When the SOFA score is 11, the mortality is 40%. When the score is 12, the mortality touches 50%. When the SOFA score is 18, the mortality crosses 80%. And when the SOFA score is 24, the mortality is 100%. The next graph is the SIRS criteria in relation to mortality. When the SIRS score is 1, the mortality is 10%. When the score is 2, mortality is 15%. When the score is 4, the mortality is 25%. The next graph is the Q SOFA score in relation to the mortality. When the Q SOFA score is 0, the mortality is 10%. When the score is 1, the mortality is 15%. When the score is 2, the mortality is 20%. And when the score is 3, the mortality crosses 30%. This concludes the talk. Thank you.